My name is Miranda Pettengill, and I'm the Manager of Education and Events here at the International Museum of Surgical Science. If you've never been to the museum before, we have 4 floors of art and artifacts. We're located in a beautiful Gilded Age mansion right on Lake Michigan. And today I'm going to be taking you through some of the coolest and most popular objects in our collection. We're going to start by looking at what is perhaps the most iconic piece of art in the museum, and that is our amputation painting. So let's take a closer look.
Let's start by taking a look at this painting together. The first thing you might notice, because it's certainly the first thing that I notice, is that the patient, the man getting his leg amputated, is awake. That's because this painting is taking place in around the mid-1800s, and that's before the era of modern anesthesia. During this time period, only about 25% of people would have had access to anesthesia, and unfortunately, our poor patient was not one of them. So imagine the most painful thing that's ever happened to you, and it's happening to you while you're being held down by 5 burly men. You're lying on your kitchen table, and you have no painkillers at all, except for, hopefully, a couple shots of whiskey. But that's about the best they could do in this time. Another thing you might notice about this painting is that nobody is wearing gloves, scrubs, or any other kind of protective gear. We talk so often about how important it is to wash our hands to prevent the spread of disease, but this painting is taking place in a time before people knew that. This is before the era of germ theory. Nobody knew that germs existed. Doctors knew that infections happened, but they didn't know why, so they didn't know how to prevent them. That means that this doctor down below holding the saw, he probably didn't wash his hands very well. That means that the tool he's holding, probably not particularly clean. Definitely none of the assistants wash their hands. The wound site is probably not disinfected. And this leaves room for a major, very dangerous infection after the surgery. In this time period, sometimes people got through an incredibly painful surgery only to die after the fact from infection. So why were we, as a Western society, so ignorant of germs? Well, think about it. If you live in the 1800s and somebody says that there are these little things that float through the air and they can transfer it from person to person and they make you sick but you can't see them, that idea would sound totally preposterous. We just have the science to back up our ideas now. It was really ridiculous to people in the 1800s for a couple reasons. One is that people in the 1800s were extremely Christian in Western society. And so the idea that there were these little tiny things that made you sick floating around, it really sounded like pagan superstition. And so people were really wary of that. Another reason is that at the time, there was a saying, "A gentleman's hands are always clean." So if you tell somebody, especially somebody very educated and fancy like a doctor, to wash their hands, you're basically implying that they are unclean and that they're not a gentleman. So people especially didn't want to hear that. I'm going to tell you a story about somebody whose work was one of the first to prove germ theory in the West. His name was Dr. Semmelweis, and he lived in Vienna in the 1840s. He worked in a hospital where he managed 2 maternity wards. Now, these maternity wards were very similar, but they had one distinct difference. One was staffed by medical students, and one was staffed by midwives. And one of these maternity wards had a much higher mortality rate than the other. So, if you had to guess, which do you think would have a higher mortality rate? Medical students or midwives? There are valid reasons to argue either answer, but the reality was that it was the medical students whose ward had a much higher mortality rate. And Dr. Semmelweis didn't know why. He did some experiments to try to figure it out. So the first thing he did was he had the medical students and the midwives switch maternity wards. And the high mortality rate followed the medical students. So then he knew that it was something about the medical students and not something about the room they were in, for example. The next thing Dr. Semmelweis did was think about the order of tasks that each of these groups of people did in a day. So the midwives were specialists. They spent all their time in the maternity ward helping new mothers give birth. The medical students, on the other hand, had a variety of rotations that they had to complete in a day, and they might have spent time in many different areas of the hospital. Dr. Semmelweis noticed that some new mothers in the medical students' maternity ward were exhibiting symptoms of a particular fever that was also exhibited by cadavers in the hospital. And he realized that the medical students were coming to work in the maternity ward right after dissecting those cadavers in a lab. And in between, these medical students were not washing their hands. It was not common practice at the time to wash one's hands. So Dr. Semmelweis realized that these medical students were literally carrying something bad on their hands from the cadavers into the maternity ward, something bad on their hands that they couldn't see. And so he made everybody start washing their hands. And there was a lot of resistance at first. But when he made everyone start washing their hands, the mortality rates in both maternity wards went way down. So you'd think this is surefire proof of his theories. So even though Dr. Semmelweis had this evidence to back up his claims, nobody in the medical field believed him for those very reasons that I named earlier. They just thought it seemed too ridiculous. And it takes people time to adapt to change. But it meant that he was ridiculed by the medical establishment. His wife actually left him, and he died later in a mental institution. And then it was only a decade or two later that people realized that he was absolutely right, that germs exist and that we need to wash our hands to get rid of them. So, R.I.P. Dr. Semmelweis. All right, back to the amputation painting. Clearly, this painting is taking place in a time before Dr. Semmelweis's ideas had arrived to wherever this painting is taking place. Let's take a look at the painting again. What else do you notice? One question you might have is, where is this taking place? It's a kind of nondescript room. Doesn't really look like a hospital. This painting is actually probably taking place in the patient's home. In fact, they're probably lying on his kitchen table. There are a few reasons why surgeries would often have taken place in the home. One is that their homes were often much cleaner than hospitals, where, again, nobody was washing their hands. But another big reason is that it might have been really difficult to get to a hospital. If you are living in the mid-1800s, what forms of transportation exist? If you don't have a horse or you're too sick to ride a horse, you're basically out of luck. So a doctor often would come to your house to perform procedures. Another little detail that can be easy to miss is that in the bottom right-hand corner, there's a bucket. That bucket might be to catch blood. It might be filled with water to dunk the bone saw in afterward. Remember, they wouldn't have cleaned them very well. Something else to notice is that there is a tourniquet on the patient. It's made out of some kind of rag, so it's a really early form of tourniquet. I pass by this painting every day, and it makes me grateful for modern medicine.
All right, next we're going to take a look at our iron lung. Come a little closer.
Let's take a look at this iron lung together. Depending on how old you are, you might know a lot about iron lungs, or you might not know much at all. Iron lungs were devices that helped treat polio. Well, essentially, polio paralyzes you. It affects your nerves, and it degrades your muscles, and it makes it so that you can't get up and walk around, but you also can't do some things that are essential to living, like, for example, breathing. We don't think about it very hard, but we use our diaphragm and our muscles to breathe, to push the air in and out of our bodies. So when you have a particular type of polio, you become unable to breathe, and this device helps you do that. So this device isn't exactly a treatment for polio per se, but it keeps your body alive while your body is trying to fight the disease. So how does an iron lung help people breathe? Well, for starters, people's bodies go inside this contraption. Do you see on the left-hand side, there's kind of a curved metal part? That's a hook keeping the machine closed. If you unhook that part, that whole entire side of the machine, the left-hand side, will swing open, and you can put a patient's body inside. And then their head protrudes out of the machine through an opening. and their head would rest on that platform that you see on the left-hand side, hopefully on some kind of comfortable pillow. Do you see the pressure gauge on top of the machine? This device uses negative and positive pressure to force somebody's body to breathe. So inside the chamber, it's airtight, and it creates a vacuum, which forces your chest and your lungs to expand and contract. It's basically pushing down on your chest and pulling up on it using air pressure. So it's making your body breathe for you when you can't use your muscles to do so. Some people recovered from polio and some people didn't. And depending how long it took people to recover from polio, they might have had to live inside these iron lungs for weeks, months, even years. Imagine a hospital ward full of dozens and dozens of iron lungs with people inside them. That's what hospitals would have looked like during the height of the polio epidemic in the 1940s and 50s. Do you see down at the bottom in front of the iron lung to the left? There's a small wheelchair. Who do you think this wheelchair would fit? Probably would only fit a child. That's because polio most often affected children. So imagine being 6 or 7 years old, you're full of energy, and yet you are forced to live inside of one of these machines for weeks and weeks while your muscles atrophy and you grow more and more bored and restless. A lot of times, even when people recovered from polio, their muscles were still affected for the rest of their lives, and they might have had to use assistive devices, like that wheelchair, or like the braces that are tucked away on the right-hand side of the display, in order to move around. Some people were so affected by polio that they had as children that they were forced to live in iron lungs for the rest of their lives. I encourage you to search iron lung on YouTube later. There are videos, little documentaries, about people who live in iron lungs still to this day. One man was completely paralyzed from his polio experience, even though he essentially recovered, and he ended up living in an iron lung for maybe like 22 hours out of every 24 hours. But he still managed to live an incredible life. He wrote a book by using his mouth to operate a stylus to press keys on a keyboard. It's pretty remarkable. There are some people who had iron lungs in their homes and would sleep in them. Their bodies couldn't handle being out of the iron lung for 24 hours a day, but they could handle most of their waking hours, so they just ended up spending the night in them. Ultimately, people recovered from polio in a lot of different ways and had different needs afterwards. Sometimes that involved having an iron lung in their homes. So what about polio today? Well, we still have no cure for polio. But we, as a newer generation, don't really have to worry about it anymore. And that's all due to the polio vaccine. It was developed in the 1950s by Jonas Salk, and it essentially eradicated polio within the United States and in much of the Western world. There are some countries where polio still exists, and if you travel there, you might have to get a polio booster shot. But it's likely that everybody listening to this video has had a polio vaccine. And if you saw this image of the iron lung and you didn't really know what it was or what it did, that is a blessing because it means that you don't have to worry about polio. And we owe all of that to Jonas Salk's polio vaccine. So let's just take a second and say thank you to the vaccines in our lives.
Welcome to our Gynecology and Obstetrics Gallery. We're going to take a look at this painting, which depicts the very first successful C-section in Latin America.
Okay, let's take a look at this C-section painting together. Now, when most people see this painting, they recoil in disgust. I get it. That's the first thing I did too when I saw this painting. It's pretty intense. There's just like a mother with her stomach open. There's a baby being held upside down right on top of her. It's pretty grim. But I'll tell you that this painting is actually depicting like a good, happy event. This is a depiction of the very first successful C-section in Latin America. And by successful C-section, I mean that both the mother and the baby survived. So this was in 1844 in Colombia. Now, today in the Western world, we think of C-sections as really pretty safe procedures. But back in the day, before 1844, this was not the case. C-sections were only done as a last resort. They were done to save the mother if she was definitely going to die. Sometimes they were done to save the baby if the mother had died. Or they were done in order to do separate burials for mother and baby if they had both died. It's a tragic history. But this painting depicts the first time that both the mother and the baby survived in a C-section in Latin America. So rest easy knowing that everybody in this picture was okay. I'd like us all to turn our attention to the mother, the patient. Do you think she is under anesthesia? Most of the time, people answer no to this question because she looks like she's in pain, she's pretty pale. Also, the time period would suggest that she probably wasn't under anesthesia. And it's true that she isn't under the kind of modern anesthesia that we have today. But she was under a kind of partial anesthesia, an herbal anesthesia made of plants. This anesthesia is actually featured in the painting, although it can be hard to see if you don't know what you're looking for. It's over on the left-hand side, on that table where that woman is working. It's in the bowl with those kind of weird-looking round things. Those are sea sponges, and they're soaked with this anesthetic concoction. Like I said, this anesthetic is made of plants, and it's made from a particular kind of plant, a mandrake. If you've heard the word mandrake before, it might be from Harry Potter. Do you remember in Harry Potter, they have to care for these plants that look like little screaming babies, and if you hear the scream, you are paralyzed, so you have to cover your ears the whole time? Those are mandrakes, and J.K. Rowling, the author of Harry Potter, took that lore from real mythology about mandrake plants. Mandrakes have roots that look like little arms and legs, so in the lore surrounding them, people have often personified them and said they look like tiny people. But there's probably so much mythology about these plants because they're quite potent. They're a member of the nightshade family that also includes plants like belladonna and datura. If you take too much mandrake, it can definitely kill you. But in the right doses, it's a hallucinogen, and it can also be used as an anesthetic. So here's how they would make this anesthetic. They would grind up the mandrake root and make a powder out of it. And they would make some kind of solution out of this powder by adding water. Then they would take those sea sponges and soak them in the mandrake solution. Then they would let them dry so they become really concentrated. And then they would soak the sea sponges one more time in something else. Wine. Red wine, actually. If you look closely at the bowl, you can see that the liquid looks red. So they would take these sea sponges soaked with this mandrake and wine solution. They would squeeze them over the patient's mouth and over her face, and it would dull some of the pain of the C-section. Not entirely. I mean, you can tell that the patient is not having a good time, and the doctor standing next to her is also holding down her arm. But it probably would have made her a little bit disoriented, a little groggy, and it would take away some of the more extreme pain of having this surgery while awake. What else do you notice in this painting? I often have people point out to me that there's a priest in the right-hand corner. Why do you think that is? Well, we know that Colombia was and still is today a very Catholic country, so it's an indicator of the time and place where this is happening. And because this was the first successful C-section, they didn't know if either the mother or the baby would survive, and so there's a priest there to read last rites, just in case. Next, let's look at what these doctors are wearing. So let's think back to the amputation painting. How do these doctors' clothes differ from what those men were wearing? Well, these doctors are a little more finely dressed, and they have aprons on, which I guess is an improvement. But this is still not a sterile environment. They still aren't wearing gloves. Their hands might not be particularly clean, and the aprons really do more to protect their fancy clothes than to prevent germs. So there was still a major risk of infection after this surgery. I've never given birth or had a C-section, but I feel grateful that if I had one today, it would be significantly more sterile than this.
All right, now we're going to take a look at these skulls who all have the same unique identifying feature. Let's take a closer look.
You might notice that these skulls all have holes in them. These are holes that are not really supposed to be there. So, why might these skulls have holes in them? You might think it's from injury. That's certainly one way that a person can get a hole in their skull. But we know that these holes were intentionally made through surgery. So, these skulls are from 2000 BC, which is 4,000 years ago, and they are from Peru. This is the oldest surgery that we have on record, and it's called trephination. Now, we know a little bit about trephination. We know that it has some concrete medical uses. For example, why would you make a hole in somebody's skull like this today? Sometimes a doctor might do this in emergency cases in order to relieve pressure on the brain. That's one reason that these ancient Peruvians might have done it too. We also know that this surgery had some kind of spiritual significance. In a time before we as humans understood that the brain, just like any other organ, could get sick, ancient Peruvians interpreted severe mental illness as something that was caused by bad spirits being trapped inside the skull. And they thought that the only way to let those bad spirits out was to create an opening. And so that's what they did. So these holes were made by man-made tools that were used in a hammer and chisel style, and the patients would have been awake during this surgery. You might be surprised to learn that over half of patients who went through this surgery survived, 60% or so. And we know that because of looking at the surgery sites. So look at this skull, for example. Do you see how the bone kind of dips in and how the hole in the skull clearly used to be bigger? There are signs of bone regrowth or bone remodeling. So we can tell that this person lived for some time after their surgery, enough time for the bone to regrow. Trephinations have been performed all around the world for different purposes and in different cultures to treat anything from epilepsy to migraines. But since in this time period and in this place, this procedure had some kind of spiritual significance, it would have been performed by somebody who had a dual role as a medicine worker and as a religious figure. And this person would probably have been chewing the leaves of the coca plant, the same plant that we get cocaine from. And while performing the surgery, they would spit some of those chewed up leaves into the wound, which would provide some numbing and would serve as an early form of anesthesia. While it can seem tempting to look at these skulls as oddities or relics of this past time period, which they are to a certain extent, it's important to remember that these skulls belong to people. These were people with lives and loves and interests and dreams and desires, just like us. And 4,000 years from today, people will probably have the same view of certain medical procedures we currently perform as we do of these trephinations.
Welcome to our Japan gallery. This gallery is all about medical history in Japan, and we're going to be taking a look at a painting that depicts a very important Japanese doctor right up here. His name was Dr. Seishu Hanaoka.
Dr. Hanaoka is famous for developing the very first general anesthetic that we have on record. Remember that a general anesthetic is something that knocks you out and puts your whole body to sleep, as opposed to a local anesthetic which just numbs part of your body. Dr. Hanaoka developed this anesthetic out of a mixture of plants, including some plants like datura that can be quite poisonous, but in small amounts they can work as an anesthetic. He spent many years developing his recipe, and he tested it many times on animals to try to get the proportions right. This painting depicts the beginning of human trials for his anesthetic. That woman lying in the foreground on a mattress is Dr. Hanaoka's wife, and the older woman sitting next to him, that's his mother. Now, the story goes that he actually asked his mother to be his test subject, and she agreed. But when his wife found out, she insisted that she be the test subject, because she said, apparently, you can always get a wife, but you can never get another mother. Now, it's hard to know if that really happened, but he definitely tested on his wife and not his mother. Dr. Hanaoka's anesthesia was successful, and he went on to pioneer a number of important surgeries, including one to remove breast cancer tumors. He is known today as the person who developed the first general anesthetic. This was in 1802, which was 40 years before anyone in the West discovered any kind of modern anesthetic. But due to Japan's isolationist policies at the time, the news did not travel around the world, and that's probably part of why it took the West so long to catch up. Back to Dr. Hanaoka's wife. I'm happy to say that she woke up from this test and was fine, although after many years of repeated tests, she eventually went blind. This is a part of the story that often gets left out, and it's interesting that today, Dr. Hanaoka's name is fairly well known, but hers is not, even though her contributions are what made his discoveries possible. This speaks to the way that the stories of women in the medical field, both as healthcare providers and as patients, have been erased in favor of the stories of men.
We're going to be taking a look at this painting. This is a copy of a Rembrandt, and it's called The Anatomy Lesson of Dr. Nicholas Tolp.
We are so lucky to have this painting because it's a copy of a Rembrandt. The original is in the Mauritshuis Museum in The Hague, in the Netherlands. So let's take a look at the figures in the painting. All the way on the right, we see a teacher figure. The name of this painting is The Anatomy Lesson of Dr. Nicholas Tolp. That is Dr. Nicholas Tolp. So this is an anatomy lesson, not a surgery. The subject on the table being dissected is dead, which is pretty clear from the way he looks. The rest of the figures in the painting are observing and learning. This was painted in the 1600s, and during this time period, public dissections like this would have been quite common. In fact, they were mostly much bigger than this. Imagine a circular auditorium. In the middle is an open space where there sits a table for a body to lie on, and sloping up toward the heavens are several levels of balconies that could hold up to 200 or 300 audience members. Public dissections like this were quite popular. Regular everyday people, not just medical professionals, would pay a fee to come and watch these dissections. There was no HBO in the 1600s in Europe, so this is what they did with their Saturdays. One major question visitors often have is, where did they get the bodies? It's a good question. This man in particular, his name was Aris Kint, and he had been convicted of robbery and had been executed by the state, either earlier that day or the day before. During this time period, it was only legal to dissect the bodies of convicted criminals. But since these public dissections were so popular, the demand for these bodies was higher than the supply. So, where did anatomy schools get their bodies? Sometimes they robbed graves. In fact, the man who we still consider the father of modern anatomy today, his name was Andreas Vesalius, he lived in the 1500s, did quite a bit of grave robbing. And this painting has a reference to Vesalius. He lived about 100 years before Rembrandt did. Do you see that book in the bottom right-hand corner of the painting? That's a copy of Vesalius's volume called De Humani Corporis Fabrica, or On the Fabric of the Human Body. And by including it in his painting, Rembrandt is paying homage to Vesalius, who made an enormous impact on the field of anatomy.
Welcome to our gallery all about x-rays. This is an x-ray machine. What part of your body do you think it x-rays?
If you said feet, you're correct. Check it out. There's a platform in back where if you stand on it, you can insert your foot into the machine to have it be x-rayed. This device is called a shoe-fitting fluoroscope, and that's because it held a prominent place in many shoe stores from the 1920s to the 1960s. Sometimes elderly guests will come to the museum and say that they remember seeing this in shoe stores during their childhood. So why were these in shoe stores? Well, supposedly they would help you find the perfect fit. You could try on a pair of shoes, stick your toes into the x-ray shoe fitter, and see if it fits properly. Do you see those long metal tubes on top? That's where you could look down into the machine and see an x-ray of your feet. In reality, this was more of a marketing ploy. You don't really need an x-ray to help you find a well-fitting pair of shoes. But you can imagine how popular these must have been with children. Imagine going to a shoe store and being able to see an x-ray of your own foot. That would be pretty cool. But these x-ray shoe fitters are no longer in shoe stores for pretty obvious reasons. If you're not careful, x-rays can easily cause cancer. In fact, these devices are connected to specific cases of cancer, and they particularly affected people who were around these machines a lot, like shoe salesmen. These machines are reflective of the way that, before we knew how dangerous x-rays could be, they used to be quite trendy. There were any number of x-ray devices being sold for cosmetic purposes, usually marketed toward women. Take a look at this device, for example. It's called a violet ray, and it was invented by Nikola Tesla. It's called a violet ray because it emits a beautiful violet light. When the violet ray first came on the market, it was said to cure any number of ailments, from lower back pain to asthma. It was shown to be particularly effective at clearing up acne and removing body hair. It certainly did both of those things. It would kill any bacteria living on somebody's face, so that would clear up acne, and it would also burn somebody's hair off, so it definitely removed body hair. Years later, the use of the violet ray was connected to extreme cases of skin cancer. Imagine having used the violet ray for acne prevention, and then years later needing a skin graft all over your face because of it. The violet ray is a great reminder that even today, we should be skeptical of new medical fads before we truly understand their impact.
Welcome to our historic apothecary. Let's take a closer look at some of the items on these shelves.
Welcome to our historic apothecary. This exhibit was created by two real apothecaries that were transported to the museum. One was the Sackett and Tabor Apothecary from 1873 in Addison, New York, and one was the apothecary shop of Dr. Uriah C. Jones of Breda, Iowa in 1882. In fact, Dr. Jones is still with us. You see that mannequin in the background? That's him. He keeps watch over our exhibits at night. Imagine that you're living in the 1870s and you develop a cough. You head to this apothecary and the pharmacist, Dr. Jones, sells you the popular medication, Dr. Thomas's eclectic oil. In the 1800s, Dr. Thomas's eclectic oil was sold to the public as a cure-all. It claimed to clear up a number of ailments, including burns, colds, coughs, arthritis, and asthma. It even claimed to cure deafness in 2 days. Dr. Thomas's eclectic oil is an example of a patent medicine, a term used to describe prepackaged medications sold over the counter at a local apothecary with no doctor's prescription. Patent medication often used dangerous ingredients to offer what people needed most: pain relief. Many of these medical concoctions contained substances to take away the feeling of pain, such as alcohol, morphine, opium, and cocaine. And yes, while these ingredients could mask the pain, they had terrible side effects. You could overdose and die, for example. Before the 1900s, there was no Food and Drug Administration, and there was no requirement to list ingredients on food products or medication, so it was quite difficult for patients to make informed decisions. Consumers often relied on advertisements to gain information, and these advertisements were often misleading. Let's take a look at this medication, for example. Mrs. Winslow's Soothing Syrup. Who do you think this was marketed towards? We see a picture of a woman. She represents the ideal image of motherhood. She's beautiful, she's put together, and she's faithfully and tenderly tending to her cherubic child, giving him medication. It says at the bottom of the advertisement, for children teething. So this medication was marketed toward mothers who wanted to help alleviate their children's pain while they were teething. This advertisement makes the medication look safe, but this medication was actually full of morphine and could easily kill a child. In fact, it became nicknamed the baby killer. And it was because of medications like this, like Mrs. Winslow's Soothing Syrup, that were advertised with these idealized images, that the Food and Drug Administration was created so that consumers could really know what was in their medications. Ultimately, it's a privilege to live in a time period where we are able to make informed decisions about the food and medicine that we put in our bodies.
Thank you so much for going on this journey with me. We've talked about surgery all the way from 2000 BC through the mid-1800s. We've talked about anesthesia, antisepsis, amputations, anatomy, all the A words, and I hope this has made you grateful for modern medicine. So when it's safe, please come back and visit us to see these artifacts up close.